what sparked this presentation was this question: how does CGRP cause migraine? It was that word cause that got me thinking. My answer to that question at the time was that it doesn't. I'm going to alter that slightly and actually say I don't think it can.
But why?
Start by asking this question: what is the age of a person who experiences their first migraine? And the answer to that question on a WHO website is that migraine most often begins at puberty and generally affects those aged between 35 and 45 years. It is more common in women. The next question to look at is, what is CGRP? Well, it's an important multifunctional neuropeptide with receptors that are present on many cell types across the body. I want you to ask yourself this very, very important question. Why would a multifunctional neuropeptide that your body needs to function as nature intended change into a molecule to cause illness? For me, it does not make sense, and it's certainly not neurological. So perhaps we should start by taking a fresh look at the definition of etiology. It is the science that deals with the causes or origin of disease, the factors which produce or predispose toward a certain disease or disorder. And for migraine, the exact cause is unknown, but it is thought to result from a release of pain-producing inflammatory substances around the nerves and blood vessels of the head. It can be triggered by alcohol and certain foods. Well, that is the etiology according to WHO. But that etiology and the definition of such is based on the germ theory, the scientific theory proposed by Louis Pasteur in the 19th century for many diseases. There is growing scientific research and evidence to support an alternative theory proposed at the time of the germ theory, the host theory, and that is more true. It was Bichon who advocated what he called the terrain theory, but it's more commonly known as the host theory. And it recognizes most pathogens as scavengers, only capable of instigating disease in an unbalanced host. That word unbalanced is extremely important. So one thought, based on the growing evidence supporting the alternative theory, is that we need to challenge the current definition of etiology, especially if our current illness behaviour is to be transformed into one of wellness. And one possible way to do that, we start potentially with a new way of writing etiology, which would also be about bringing life to medicine. And that definition would look a little like this: the science of emotions and awareness that enables thoughts to come and go, that together feeds wellness, centering the person and empowering mind and body to flow and glow. Also, I hope it will explain why I feel emotional health services are needed in centering a person and empowering them to prevent and heal from mental and physical illness, which I'm calling acquired mind injuries. But we need to start with what's an emotion. The definition that I've adapted from Wikipedia is it's a complex experience of consciousness, bodily sensation and behaviour that reflects the personal significance of a thing, an event or a situation. What is an emotional experience? Well, it's that which can be expressed externally, what you and the person can see, that which you and the person can feel, the internal process. Because emotions and feelings are made. But how? Through the involvement of a neurochemical process. And where do those chemicals come from when a person is triggered for the body to be stimulated into performing actions, reactions and interactions? Well, from the cells in the body, including the brain and spine, which become associated with a process that changes a person's feeling of physical and mental well-being. And this is a quote from a very famous book called Molecules of Emotion by Candace Pert, who was involved very much in finding and discovering the opiate receptor. This is her logic The only reason that made any sense for an opiate receptor to be in the brain in the first place was if the body itself produced some kind of substance, an organic chemical that fit the tiny keyhole itself, a natural opiate. And those natural opiates are what became known as endorphins, because that word is made out of two words, endogenous morphine. But can the nature of those changes vary depending on how receptive a person is in experiencing the emotion? Well, when a person is receptive to a trigger on an external and physical level, their body is more likely to be receptive at an internal and cellular level. But what happens if a person is less receptive to a trigger? When you're in that environment of loud noises, then you can outwardly react on a physical basis. But what if there is no conscious action or reaction? Well, this is something else I think a lot of us have also experienced. Changes to your hearing after being in a nightclub. How is that reflected at a cellular level? If a person is less receptive, and remember, the body keeps the natural score, then the body will express fewer receptors. So what happens to the neuromolecules that get released due to a trigger? With fewer receptors, the concentration of the signaling molecules can increase. Then they can be transported around the body. Now this comes into the whole aspect of the fact that some things can come into a system, but they also go. Remember, nature requires systems to return to a state of metabolic balance, i.e. homeostasis. Why do I say that? Well, it happens in nature all the time. When you're breathing in and out, the trees are breathing out and in. So how can that rebalancing happen in the body? In general, I believe there are two ways. One of which is that the molecules that get released bind to receptors expressed on the various cells of the body, or something can bind to the molecules. How does science know that? Well, it starts with the research into CGRP. It is the most potent vasodilator peptide known. Vasodilation is when the blood vessels are increased, dilated, and that is a very significant moment when it comes to changes in bodily functions. CGRP gets transported around the body, including the brain and the spine. And in 1979, Michael Moskowitz discovered an association between migraine and the trigeminal nerve. That's the largest nerve whose fibers sit on the meninges. The meninges are in the brain area. And the CGRP can get released from those nerve fibers. I also was doing some research a bit later on, and I was studying CGRP up and down the sciatic nerve. But how can this neuroscience research explain the connection between a person's emotional health and their physical and mental health? Well, it starts with the major breakthrough into migraine research in 2021, when Professor Peter Goseby built on the initial work of Michael Moskowitz in 1979. They both, including another colleague, won a major prize for this research. But then I became aware of the emotional health significance of the trigeminal nerve. How did I come to that? Well, it's through living experiences. Starts with a Mr. John Scoons and his family. As it happens, I'm married to his daughter, and I became aware of a connection with the bite plate. John gave them all a bite plate to help with teeth grinding. Now, as you can see here, is a very significant connection to stress and anxiety. But the next point is very significant. There is a very major connection between the use of these bite plates and post-traumatic stress disorder. As it happens, it was a connection back to Mr. John Scoons. He was in the war, and we understand that he also had post-traumatic stress. So connecting PTSD with migraine, this is taken from the American Headache Society, and it highlights the connection between PTSD and migraine. PTSD symptoms preceded migraine symptoms in almost 70% of those with migraine and PTSD, quoting a study. So connecting PTSD with emotional abuse is another major significant connection. Also connecting the state of emotional health to migraine. We know that emotional abuse in children is significantly related to migraine later in life. In that study, and then in other studies where we look at adverse childhood experiences, ACEs, and the onset of migraine later in life. This is important, the connection between emotional health to CGRP homeostasis, i.e. the need to be able to keep those molecules balanced, the natural force for all body systems to return to a state of metabolic balance, homeostasis. And that connection comes in the form of Professor Peter Goadspeed's research. That research uncovered that something that binds to the CGRP, and that something happens to be a CGRP antibody, an antibody that they manufactured and they put into the blood, and it binds to the CGRP molecules. And the connecting factor with CGRP, migraine, and emotional regulation comes via this particular study, linking various dots here, bringing them all together. The emotional regulation is very significantly connected to PTSD, and as I've shown, PTSD is very significantly connected to the whole use of the dental bite plate, and the dental bite plate is very significantly connected to the trigeminal nerve, etc., etc. So I don't think we're that million miles away from making and joining up all the dots to create a very good picture. Just taking that a bit further forward with a bit of the science at the receptor level. A person who's less receptive to experience an emotion that actually requires CGRP, well, is that meaning the body is going to express fewer receptors? That's what I believe is happening. With fewer receptors, that means CGRP levels stay elevated and unbalanced, and the released CGRP can be transported around the body. The significance of that in terms of dysregulated systems is this essential need and the natural force that remains for all systems to return to a metabolic balance. How is that going to happen? Well, it connects in with the impact of emotional dysregulation. When levels of CGRP released into the body increase, so the CGRP is released from various nerves, what cells can CGRP bind to? Well, various. We know it can bind to mast cells, stimulates the release of histamine, so that's very significant. It also binds to the microglia cells in the brain. And microglia cells are a bit like macrophages. And interestingly, in my research, I found CGRP binding to macrophages in the sciatic nerve, also in the peritoneal macrophages, which are in the gut, and in the spleen. We're looking at CGRP having effects across many aspects of the body. When levels of CGRP released into the body increase, there is an increased chance that CGRP can bind to receptors not downregulated on various body cells, because those cells are not involved in the regulation of an emotion that involves CGRP. So how does CGRP cause migraine? It can't be the cause, because it is a natural multifunctional neuropeptide that your body needs to function as nature intended. So could the untimely release of CGRP be a cause of migraine? If so, what could trigger that untimely release of CGRP? An emotion? More likely an unpleasant emotion and or memory. In other words, emotional dysregulation. And to put that into a bit of context, if receptors on tissue cells involved in expressing an emotion downregulate, disappear, dysfunction, the CGRP released as a reaction to the trigger is likely to find and bind receptors on other tissue cells. And in this paper, it shows that the use of the antibody to the CGRP can also help in non-migraine situations, including fibromyalgia. So this is emotional dysfunction associated with CGRP. So what does a possible etiology of migraine look like? A bit like this. Migraine is associated with emotional dysregulation and a dysfunctional nervous system. It is thought that migraine can be prevented when emotions are naturally regulated, preventing the untimely release of molecules such as CGRP from nerves and blood vessels in the body. I'm just coming back to this question again for a very important reason. This was about using common senses and a neurological approach, and it was also using ChatGPT. So I'm going to just look at that. The question that was asked is perhaps the wrong question. The question perhaps could have been, does CGRP cause migraine? Because when you put that question into ChatGPT, this is what you get. Calcitonin gene-related peptide plays a significant role in the pathophysiology of migraines. While CGRP itself is not the sole cause of migraines, it is a crucial component in the complex process that leads to migraine headaches. Here's how CGRP is involved in vasodilation, neurogenic inflammation, and pain transmission. The key question is so important. If I'd put in, and I did actually put in the question, how does CGRP cause migraine? The answer was very different. The nature of your question has to be looked at very, very carefully. So it doesn't cause migraine. Importantly, can CGRP levels rebalance naturally? Does the answer to that question lie with Newton's third law of nature? Newton's third law of nature is the law of action and reaction. For every action or force in nature, there is an equal and opposite reaction. I've taken that and reworded it. For every natural emotion, is there an equal and opposite remotion? I made up that word remotion. Well, I thought I had. I went to the dictionary to see if it existed, and I was absolutely staggered when I found the definition that remotion is the act of removing. So I think there may well be something to explore. Please, this is important. We urgently need to look deeper to uncover and discover or see natural approaches that feed human health and well-being. This is why it is my hope and passion to create emotional health services with an outcome of centering the person to empower them in preventing and healing themselves and others from the physical and mental imbalances triggered by acquired mind injuries. Thank you very much for listening, and I hope you found this helpful.